Welcome to our evidence-based practice or EBP training on social narratives. Here are the learning objectives for today's training session. By the end of this session, participants will be able to gain awareness of CAPTAIN, EBPs, and AFFIRM. Describe the purpose of social narratives, identify the different types of social narratives, explain briefly what is needed to implement a social narrative, and be able to summarize and create a social narrative. CAPTAIN, EBPs, and AFFIRM. What is CAPTAIN? First, CAPTAIN stands for California Autism Professional Training and Information Network. It is an interagency network based in California. CAPTAIN was created to support individuals with autism spectrum disorders, or ASD. This is done by providing information and trainings of resources such as evidence-based practices, EBPs, and emphasizing how to use EBPs to assist students to access the California state standards and prepare them for college and career readiness. Even though it was developed for the ASD population, research shows that these EBPs are beneficial for all our students. For more information about this network, the website address is shown here on this slide. Please check it out when our training is complete or whenever you have free time. What are evidence-based practices? Evidence-based practices are a set of practices that are focused and have clear evidence of positive effects with children with ASD. Currently, there are 28 evidence-based practices that have been shown to be effective for addressing challenging behavior. These instructional intervention procedures or set of procedures are focused and backed by scientific research. For a practice to qualify as evidence-based, researchers provide information that shows it provides positive outcomes for people with autism spectrum disorders. EBPs can be utilized across all settings, including the home, clinic, other therapy sessions, and most importantly, in schools. The Autism-Focused Intervention Resources and Modules, also known by its acronym AFFIRM, provides modules that are designed to help you learn the step-by-step process of planning for, using, and monitoring an EBP with learners with autism from birth to 22 years of age. Supplemental materials and handouts are available for download from the site listed here. To learn more about AFFIRM, please visit the website. It will direct you to the AFFIRM homepage, where you must create a free account in order to access a plethora of resources, including modules on EBPs.
Let's now focus on the EBP of this presentation, social narratives. First, we will cover the purpose of a social narrative. Social narratives are interventions that describe social situations for learners to highlight relevant features of a target behavior or skill and other examples of appropriate responding. Based on the individual needs of the student, a specific behavior or situation is targeted and appropriate behavior expectations are provided. Social narratives are short, often told in a story format from the perspective of the learner, and include pictures and visual aids. The text and images highlight important aspects of social situations to increase a learner's ability to navigate a challenging situation. Although the story is told from the perspective of the learner, it also describes thoughts and feelings of other people involved in the situation. Social narratives are aimed at helping learners adjust to changes in routine, adapt their behaviors based on the social and physical cues of a situation, or to teach specific skills or behaviors. Studies included in the 2014 EBP report detailed how social narratives can be used effectively to address different outcomes. The chart shows what outcome can be successfully achieved by each age group. Currently, there are no studies that show ages 0 to 2 benefit from using social narratives. However, this evidence-based practice has been effective with learners in preschool, 3 to 5 years, all the way to high school learners, 15 to 22 years. Social narratives are aimed at helping learners adjust to changes in routine, adapt their behaviors based on the social and physical cues of a situation, or to teach specific skills or behaviors. They are designed to promote social understanding in various areas. They help strengthen communication, problem solving, self-management, peer relations, and initiating and maintaining social interactions. Here are just a few of the many behaviors and skills that can be targeted with a social narrative. As you watch the following video, concentrate on the learner in green. Keep the following guiding question in mind as you watch. What specific behaviors and skills does the learner struggle with in the video?
Buddy, don't eat those. Oh. Gotta really hurry up, Walter, because I'm double booked the rest of the afternoon.
Am I sick?
Yeah, but that's not what we're here. We're here to do a test. Come on.
What kind of test?
Just a test to find out if you're my son or not.
Why am I sitting on paper?
Because it's sanitary for the other patients. Now sit still so I can do the finger prick.
Finger prick. Oh, it's cold.
Yeah, just please sit still, please.
Okay, can I listen to your necklace?
No, you can't. Can you just sit still?
Why is there a skeleton
I
on the
don't
wall?
know what. Walter,
If I
could you
squint, it looks like
please?
a pirate
Could you
flag.
please have him sit
Does he
still
have
so
a
I can
name?
do
No,
this?
he has got a name. I'm
I
sorry,
have a lot
Ben.
of
I'm
patients
sorry. Would you
waiting.
please sit still? Please.
He got mad at me.
Yes, he did. He did. The sooner you sit still, the sooner we can get this mess over with.
Okay.
Then can we eat sugar plums? You betcha. We'll eat sugar plums, gingerbread houses, and we'll even paint eggs. Well, paint eggs, that's easier. Ow! Oh! My finger has a heartbeat.
What types of social narratives would Buddy the Elf benefit from? Please take a moment and pause this recording now to write down a few of the specific behaviors and skills that the learner struggles with in the video. Possible answers that you might have written down include putting objects in their mouth, trouble reading others' emotions, touching other people's things, knowing when to ask questions, interrupting, and even what to expect when you visit a doctor's office. There are many benefits to using social narratives with students. They help students adjust, adapt, prepare, and learn specific skills or behavior that a student may be having difficulty with. They provide missing information that a student may need to be successful. Social narratives can enhance conversation skills, increasing social interactions. They also give insight to how other people are thinking and feeling. Because social narratives provide clarity about expected behavior, they increase appropriate responses in social situations. They support students in learning new routines and make it easier to follow directions. Because social narratives help students cope with and adjust to change, they can reduce tantrums and decrease challenging behavior. Anxiety can also be reduced by giving information of what to expect in a particular situation. Social narratives can alleviate some of this worry. Social narratives are best used prior to a new school experience or transition, such as getting a new haircut, or meeting a new teacher, or going to a doctor's office. They should also be read as an intervention or reinforcement prior to when you know an existing behavior is likely to occur. If you know a student has trouble keeping their hands to themselves at recess, reading a social narrative about this behavior before recess would be best. After a social misstep has occurred, such as a poor interaction with a peer or saying something that sounds rude to a classmate, hitting or yelling. They can also be read after a major event to increase an individual's understanding, after a pet dies or maybe a friend moves away. Take a minute and think of one student in your classroom or that you work with that has difficulty with a specific behavior or situation. What behavior or skill is a challenge for this student? They might have difficulty with personal space or making friends. Maybe there's a social situation that is coming up that you know will be challenging for that student, such as a school-wide assembly or field trip. Keep this student in mind as we begin the next learning objective.
In this section of our training, we will discuss the two types of social narratives that have been labeled as EBPs. Under the social narrative umbrella, you can see there are multiple types of social narratives. In fact, there are 6 recognized ones. This visual shows you the different types: social stories, social articles, cartooning, comic strip conversation, power cards, and social autopsies. This is great as you have choices. However, in today's training, we will focus on social stories and power cards, indicated by the red arrows. These two types are recognized and formally supported by the research as evidence-based. Social stories are the most well-known and frequently used social narrative. They are a focused intervention strategy that's been developed by Carol Gray. Social stories describe a social situation and appropriate behavior by using sentences that describe or direct the learner. Power card uses a learner's special interest. Power cards provide a short scenario and rules on a small card that helps a learner understand the social situation. So let's start by reviewing some important social story vocabulary. Author. The author is you, the person who researches and develops a social story. There's the audience. The author writes for a specific audience. This is often a child, an adolescent, or adult with autism. Each social story is developed with consideration of several individual factors, including but not limited to the age, gender, abilities, personality, preferences, and/or interests of the audience. Every social story has a title that represents the topic. In addition, social stories use sound story construction, using an introduction, body, and conclusion. Social stories contain only first and third person statements. Social stories omit second person statements. According to Carol Gray, the goal of a social story is to share accurate information using a content, format, and voice that is descriptive, meaningful, and physically, socially, and emotionally safe for the intended audience. The social story goal is to share accurate information meaningfully and safely. However, it is often behavior that draws attention to a specific concept, skill, or situation. If our objective is simply to change behavior, we are likely to focus on telling the child what to do. Chances are our audience has been told what to do many times. Instead, the focus is on the underlying causes of frustration or misinformation. Authors work to identify and share information that supports more effective responses. The theory is that the improvement in behavior that is frequently credited to a social story is the result of improved understanding of events and expectations. Social stories help learners with ASD understand a particular social situation by explaining the situation, relevant cues, and other people's perspective of the situation. Social stories attempt to provide missing information to learners with ASD to help them in developing strategies to use in a particular social situation. Stories can serve many different purposes, such as celebrating a success of a learner, preparing for an event, or changing behavior. Social Stories app allows family members and social and professionals working with learners with ASD to create, present, and share social stories on smartphones and tablet devices. Gathering information for social stories is paramount. Carol Gray's original rationale for social stories is that a child or adult with autism may frequently perceive daily experiences differently. This requires authors to abandon some assumptions. Authors consider how a situation may look, feel, smell, or sound like to the audience, or how a concept may be perceived, understood, and or processed. As you can see, the power cards requirements are very similar to the social stories. The major difference is the format. Whereas social stories can be a page created into a mini booklet or even put into an app, the power card format uses a small card about the size of trading cards bookmarks.
Now that we have discussed the similarities and differences between two types of social narratives, social stories and power cards, we will do a short overview of how to implement social narratives. It doesn't matter which of the two social narratives you're using. These steps apply to both. The planning step explains how to select a social narrative and develop the selected social narrative. You would start by first identifying the target behavior or skill that the social narrative will be addressing. Next, you would collect baseline data through direct observation if it is a possibility. Making sure you gather enough information about the social situation is very important. We will talk more about what to consider when collecting data in a moment. Based on that data collected, you would then establish a specific goal that clearly states when the behavior occurs, what the target skill is, and how the team will know when the skill is mastered. Once you have done the pre-work, it is actually time to start planning for the social narrative. It is important to identify what type of social narrative would work best with the student. Remember, social stories help learners with ASD understand a particular social situation by explaining the scenario and other people's perspective. Power cards use a learner's special interest to describe rules and behavioral expectations of a social situation. Be sure to follow the social narrative criteria according to what type of social narrative you select. For example, when writing a social story, be sure to gather information about the identified social situation before writing. Before developing a power card, be sure you collect information about the learner's special interest and determine possible reasons for the learner's problematic behavior. Make sure the text, font, and visuals are appropriate and engaging for the learner. Select times you will use the social narrative with the learner. Ideally, social narratives should be read prior to the identified social situation. If this is not possible, read the social narrative at convenient times. Be sure to read the social narrative often with the learner. After you have planned the social narrative, the next step is implementing it. Most research indicates that social narratives are most effective when read directly before the identified social situation. Find a distraction-free space to explain to the learner what the social narrative is about and the important aspects the learner should keep in mind while reading. Depending on the needs of the learner can read the social narrative independently or with an adult. Review key concepts with the learner. Asking the learner a few comprehension questions about the narrative will help you gauge their understanding. For any incorrect responses, reread the section of the narrative related to the question. Consider using role plays to provide the learner with an opportunity to practice the target skill or behavior. Next, it is time for the learner to apply the skill. Create an opportunity for the learner to participate in the identified social situation. Use prompts to help the learner participate in the identified social situation. If the learner uses the target behavior correctly, consider providing reinforcement to encourage the use of the target behavior again in the future. It is important to continually monitor the effectiveness of the narrative through data collection. On the Affirm website, there is a social narrative monitoring form that can be used as a tool to collect data on target behaviors during the identified social situation. This can be found in the resource folder. If the learner with ASD is showing progress with reinforcement based upon collected data, then continue to use this practice with the learner. Gradually, new target skills and behaviors can be introduced to the learner as needed. If the target skill or behavior is not increasing, make sure the target skill or behavior is well defined, measurable, and observable. Be sure that the social narrative was developed with the appropriate criteria and that it was written with the learner's development and age in consideration. Also ask yourself if the social narrative was used with fidelity. If needed, rewrite the narrative to improve the student's performance. When you rewrite, only change one aspect of the story. Here is an example of a social narrative implementation checklist. This is downloadable on the Affirm website. The categories are planning, using, and monitoring. Tips to help you before you start are also listed. Remember, this checklist is for implementation of any type of social narrative, including social stories and PowerPoints.
In this section, we will talk about creating a social story. Let's take a closer look at the steps to create a social story. Resources that can help you include the planning worksheet, step-by-step guide, social narrative checklist, and the implementation checklist. So let's take a closer look at the steps to create a social story. Step 1 is deciding, what will the story be about? What is the skill or behavior you want to establish, and what do you want them to be able to do? Step 2, consider what is your child's or learner's ability to read and understand language. What is the appropriate and positive language and images at your child's developmental skill level? And what are the type of language your child understands? Is it English? Is it the home language? And the sentence length and types. There are 2 types, directive and descriptive. And make sure to consider the vocabulary, the complexity of the story, and that there is a minimal directive sentences. There's 3 to 5 descriptive and perspective sentences for each directive sentence. Use first-person point of view. Use positive language. Oftentimes, professionals overestimate what our students with special needs actually understand. So please be careful about this and use the appropriate language for the child's developmental skill level. Step 3. The first step of step 3 is writing the story. You will need to start with a task analysis. For this, you must review the skill being taught, break down the task into small steps. Ask yourself, what does the student need to understand to perform the task? And also look at examples of social tasks that are broken down if you need help or inspiration. Lastly, write the steps for your task analysis into the story. As we write, let's consider the type of sentences used in social stories. There are sentences that direct and sentences that describe. Sentences that direct provide suggestions for behaviors or responses in a social situation. Sentences that describe can be descriptive sentences, perspective sentences, cooperative sentences, or affirmative sentences. For social stories to be effective, it is important to describe the social situation. For instance, there may be times when chocolate milk is unavailable. As you write your social stories, make sure your descriptive sentences objectively define anticipated events where a situation occurs, who is involved, what are they doing, and why. Consider these examples. When people are inside, they walk. At school, most people go to the cafeteria for lunch. When it is lunchtime, most students eat lunch. I go to the cafeteria for lunch. A directive sentence is an individualized statement of desired responses stated in a positive manner. They may begin, I can try, or I will work on. Avoid sentences starting with do not or definitive statements. Instead, focus on the positive. For example, I will try to walk inside. When I eat, I will touch my own food. And I drink my own drink. Let's practice descriptive and directive sentences. I'm going to read a sentence to you. Decide if you think the sentence is either a directive or descriptive. There may be times in class when a classmate tries to help me. This may happen when the teacher gives me directions and I do not follow it right away. When a classmate is trying to help me, they may tell me what I should do. They are trying to remind me of what the teacher said. Even though I may not like it, my classmate is trying to be nice and helpful to me. And last, next time my classmate tries to help me follow the teacher's directions, I will say, oh, thanks. Listen to what they say and remember they are trying to be helpful. Now here we have two social stories. When a classmate tries to help me in wearing a suit. In this story, we see 5 descriptive sentences to 1 directive sentence as recommended by Carol Gray. In this story, note that this social story is much shorter, but still follows the formula. The author included 3 descriptive sentences and 1 directive sentence. What other differences do you see between the two social stories? An example would be pictures were included in the second story to aid the learner in understanding the social situation. Social stories are individualized and should be written to match the learner's needs and abilities. Social stories also use sound story development. A social story should answer these 6 questions: who, what, when, where, why, and how. Learners with autism spectrum disorders often face challenges when having to respond to social behavior and engaging in social interactions because of their lack of understanding of social cues or rules. So it's very important to remember what social cues or concepts your student might miss in a social situation, and therefore the why is the most important part of the story. Here is another social story called Eating Breakfast. Take a moment and read the story. Sometimes searching for social stories with Google can be problematic. Social stories in Google often do not follow the formula of 2 descriptive sentences to 1 descriptive sentence. Searching for social stories with Google can be a problem because the stories are not individualized and do not follow the recommended formula. Before we end, here is a slide with the resources that were used for this presentation. Included is our Schoology course where you can access EBP social narratives resources. We are once again sharing the Captain website where you can find resources for autism. We are also sharing the Affirm modules website where you can find video links, course, and other resources on this EBP, as well as others for your classroom and for your parents. We truly appreciate your time. Moving forward with the work you learned today, please remember that although social narratives is an evidence-based practice proven for students with autism, social narratives can definitely work for all students.